Hello everyone. If TB enters lung today, why does disease appear after months or years? Answer lies in hypersensitivity and immunity. Let's simplify TB from zero. So, hello everyone. This is Brainless Medico and I am Dr. Manoj, and today we are going to learn one more important topic under infectious diseases, that is tuberculosis. Tuberculosis. So, let's dig into it. Tuberculosis is a chronic granulomatous disease caused by Mycobacterium tuberculosis, where host immune response causes more damage than the bacteria itself. As I mentioned in the first slide, it's all about hypersensitivity and immunity plays vital role in this disease. So, what is the causative organism? Mycobacterium tuberculosis. It's an acid-fast bacilli, aerobic, slow-growing, and rich in mycolic acid, which leads to even drug resistance and even chronicities. So mode of transmission goes like this: inhalation of droplet nuclei, source usually sputum positive pulmonary TB, not transmitted by utensils, food, touch. So don't behave like some untouchables who was for the TB patients. You should be careful with their aerosols. Then coming to pathogenesis, let's go with the stepwise to make it simple. Step 1, as usual, it should enter your body where bacilli reaches alveoli, phagocytosed by alveolar macrophages. Then coming to second step, it will be survival inside macrophage. As macrophage phagocytose the bacilli, then what happens? It inhibits phagolysosome fusion, then multiplies intracellularly. Then in step 3, we are going to see immune response after 2 to 4 weeks. That is where it takes so much time to reveal itself if the person is infected. So it is type 4 hypersensitivity, and type 1 helper T cells will be releasing in IF1 gamma activates macrophages, whereas TNF alpha granuloma formation, which is the last step. Purpose contains infection, so granuloma formation, it will be containing infective bacilli, where structure will be central caseation, epithelioid cells, Langerhans, giant cells. Then coming to important, 3-marker difference in your theory exam, they'll be asking. Even for the, competitive exam, it is important. It is primary and secondary TB difference. So let's dig into it. Features, you have to see age. Usually primary will be seen in children's. They are more prone, whereas secondary will be adults. Then immunity, no prior exposure, but in secondary it has to be prior sensitization. Lesion, it will be usually primary will be Gons focus, whereas in secondary it will be apical lung. Spreads through primary TB spreads through lymphatic, whereas secondary will be bronchogenic. Then cavitation, very rarely we see in primary TB. So in secondary it is most common. So basically if you are seeing a cavitation, it will be in what? Adults, right? It has to be adult X-ray. Then coming to latent TB, bacilli will be present, no symptoms, not infectious, can reactivate if immunity reduces. So what is the meaning of this latent is like? Currently the patient has been like whatever it may be treated, or maybe he has no symptoms, nothing, anything. But if his immunity goes down, he may disease may recur in his body. So at last examples, TB damage, it will be due to type 4 hypersensitivity. Then interferon gamma is key cytokine. Then TNF alpha needed anti-TNF drugs, TB reactivation. So you have to avoid anti-TNF drugs in TB patients. So this was a basic introduction of tuberculosis, and next video we will see how TB actually presents in patients and why cough more than 2 weeks does matters. So don't miss out. Subscribe to the channel. We'll meet you in the next session. Thank you.